Hello everyone and welcome to the Now in Times Talk from the Heart, a talk show where we talk about issues that matter. We speak about them openly and honestly. One of the pressing health issues of our time is cancer, and today we are going to be talking about it. From detection to gender-specific cancers and the latest in technology and treatments. These insights may help you to look at cancer differently and may even save some lives. And to talk about this, we have Surgical Oncologist Padma Shri, Dr. Ramakant Deshpande with us. Hello, Dr. Deshpande, and welcome to our show.
Hello. Thank you for having me here.
We are looking forward to speaking about cancer with you. You, doctor, have more than 30 odd years of experience in this field. Doctor, as an oncologist, what are some of the most common cancers you have seen and those which are becoming common in recent times?
That's true. Now, first and foremost is thank you for having me here. See, cancer basically represents, the diagnosis of cancer itself represents a shock in the minds of the person to whom you give this particular diagnosis, because there's a lot of misgiving about that. There's a lot of suffering which is associated with it. There's a delay, bad results, and kind of inevitably you start seeing that you're likely to depart from this world. It's not necessarily so. So we'll go step by step. What common types of cancer that I have been seeing, I've been in this line from 1982, which is like 43 years I have been doing this. And we keep seeing different types of cancers in men, different types of cancers in women. In case of women, obviously breast and the cervix, there's the mouth of the womb, and colorectal cancers, ovarian cancers. These are the common cancers what we see in women. In case of men, it's slightly different. It is the prostate cancer, the lung cancer, colorectal cancer, and the esophagus and gastric cancer are the common cancers. Now, the trends what we have been observing over a period of time is, one is the location itself. Earlier it used to be the womb cancer, the mouth of the womb cancer, that the cervix cancer used to be the commonest in case of women. But with awareness, more number of vaccinations, less number of children, better cleanliness, so all these kinds have actually taken down the incidence of the cervical cancers lower than the breast cancer. And breast cancer has now come up not only because it's a relative increase, but an absolute increase in breast cancers also is being seen. So now today it is breast, cervix, ovary, and then colorectal cancers in case of women, prostate, lung, and colorectal cancers, and esophagus and gastric cancers in case of men. These are the common cancers what we see in both the sexes.
Right. So you have already told us which are the gender-specific cancers already. Now, besides gender-specific, is there anything that is specific to our country, to India itself? Any cancers that happen mostly in India?
Oh yes, of course. India, the pastime is to have tobacco and to keep spitting everywhere. So, head and neck cancers are the commonest cancers. For example, if you go into any kind of a institution and take the registration of various cancers, 30 to 40% of cancers belong to the head and neck group, which means that it could be starting from the lip to the tongue to the buccal mucosa, throat, etc. So head and neck cancers are the most common. The reason obviously is tobacco ingestion and as well as smoking and drinking. These are the three commonest reasons for head and neck cancers. So as a group, head and neck cancer still forms the largest group. But if you take a single organ, the lung cancer is actually standing apart, and that is becoming the most common in case of males particularly. So this is exactly the speciality in case of men. In case of women, now obviously the breast cancer is being seen exactly like what happens in Western population. But the breast cancer, what you see here, is slightly different. One is the incidence itself is actually starts rising earlier in the age. The median age group is about 49, which is almost 10 years younger than what you see in Western population. So they are younger. Half of them are premenopausal, which is again unusual. Most of them are postmenopausal in the Western population. Thirdly, one third of them are less than 40 years of age. So now that is a time when you are, as a lady, you are still the backbone of the family, looking after the children, and then along comes a shock. Not only that, but the type of a breast cancer is also more aggressive. It's called a triple negative, which means that the hormone receptor negative cancers are much more common. They don't really do that well as much as the hormone receptor positive. So the overall pattern seems to be more aggressive in developing countries as far as cancer is concerned. When you take overall survivals, if you take all cancers, spread all the cancers, and you say, okay, how many of these cancer patients are get completely cured? What do you mean by cured? You must have heard of 5-year survival and all that. It doesn't mean that the patient survives only for 5 years, but it means that 5 years if somebody survives, the chance of that person going to a normal lifespan. What is the normal lifespan? It's almost about 79 years for a lady who has lived for a young age of say 5 years. A girl child should live till 79 years of age. For a man, it should be approximately around 76 years of age. That is called a normal lifespan. So when a patient is treated for breast cancer, what are the chances of that person going to the normal lifespan is the cure rate. That is what we call as the cure rate. Okay. So in case of breast cancer, if you take overall kind of survivals, in case of US today, developed country, and England, US and all that, 70% of them will get completely cured, which means that they will grow to a ripe old age of maybe 79, 80 years of age. In China, it's almost about 60% who will go to that particular age. It's from 70, now it's come down to 60 in China. In case of India, that is still 50%, which means that 50% of the all-comers still have a problem and a shorter life because of this disease itself. And the reason I told you just now, they get hit early, they get hit by an aggressive kind of a tumor. Then there are various other reasons for which the overall survival goes down, which as we go along we'll discuss.
Right. But why is it that Indians get hit earlier? What is the cause of this, doctor?
See, genetically, I think there is a lot of difference between the Western population, the Caucasian population, and the Asian population. Number two is the awareness of the disease, the ignorance, superstitions, lack of accessibility of the various healthcare facilities, and financial. Okay. Thirdly, we do not have a very well sustained kind of a prevention program, a monitoring program. We don't have regular checkups of the people, regular mammograms, etc. That whole system doesn't exist in India. Mind you, we are a population of 140 crores, which is almost like 4 times as much as in the US. Secondly, our resources are not really that powerful. We are not a rich country. So it's very difficult to monitor each and every person. People are aware that yes, if I do a monitoring, it will be better, but where are the financial avenues for them? And even if I want to do that particular thing, I have to go 100 kilometers for a mammogram, so it becomes a little difficult. So accessibility, affordability, all these kind of reasons go into delaying of that particular diagnosis. See, 70 to 80% of breast cancers which are seen in the Western countries are in early stage 1 and stage 2, where the cure rates are 80, 90 and 95%. Whereas more than 60% here are almost like stage 2 and stage 3, where the survival as such also fall down. And that is why diagnosis is still breast cancer, but we don't do as much as well as the Western countries.
Right. So, you rightly said, K, when you get the diagnosis that this is cancer, it is more than a shock. You don't know how it has happened. You don't know how to move forward. Now, what are some of the signs and symptoms that we in India we ignore?
See, cancer can hit you in very many ways. The cancer can be in the esophagus, it can be in the lung, it can be in the breast, it can be in the colon, whatever different types. Based on the location, you will have a different kind of a symptom. And then the symptom also in cancer is waxing and waning. What does it mean? You may have symptoms for some time, then it goes down, then again it comes back. So there is a time lag before you start really feeling that now it's getting too much. That also actually adds to the overall dealing. So, now, what are the common symptoms? Anything which affects your day-to-day normalcy. Please understand one thing: our system is built of many kind of organ systems. Each one function. Like for example, you have a digestive system. You take your food in your mouth, then it goes down, then it gets digested, then you pass it off as a kind of the excretion. All right. Now, along this, you can actually have multiple symptoms. You can have a difficulty in swallowing. You can have hyperacidity or pain in abdomen. You can have the excess gas or discomfort in the tummy, or you can pass stools while passing stools. You can pass blood. These are various symptoms. All right. What happens is, suppose there is a cancer of rectum. So the patient actually develops some kind of a discomfort. No, I'm not passing stools very well. I get constipated for some time, but lose motions for some time, and then the guy just takes some medicines. Now, self-medication is very common in India because you can just get those medicines across the counter, which is not possible abroad. All right. Secondly, we don't really go to our family physician routinely as such. Secondly, even if you go, quite often you are just treated symptomatically. And nobody is going to ask you for a barium enema and a colonoscopy and all that merely because you have a once bleed or something like that. No, it must be piles or something like that. Take this particular medicine. With all these kind of things, even if a patient goes actually to a medical gastroenterologist, quite often there's an average time loss of almost 4 to 6 months. Now you can imagine there's a fire burning in your rectum. And then for 4 to 6 months, you don't really arrive at a good diagnosis. Why does it happen? Because see, rectum is a capacious organ. A small tumor there, till it reaches to a large size causing obstruction, the symptoms are not very severe. Unless and until it keeps on causing bleeding. In which case you go and say, no, every time I pass stools, I'm passing bleeding. Then that is a warning system. But it may not present that particular way in every single time. But understand one thing. Any disturbance in your daily body functioning for which lasts for more than a month, like for example, you have a cough, you may get cough, normal cough goes off within 8, 10 days, 15 days, whatever, whether you treat it or not. But something which lasts for more than a month, or you started bringing blood out of your sputum, or you started getting change of voice, all these things actually point at something sinister. At the end of it, it may still not be malignancy. Difficulty in swallowing. Okay, now while conducting this program, somebody brings a hot cup of tea to you, and you're on to your next question. You just gulp it, and it's burning. You burns your esophagus, and for the next 2-3 days, you'll say, no, I'm getting a little bit of difficulty in swallowing, but it goes off. In about 5-6 days, you are back to normal. And if that doesn't happen within say 2 or 3 weeks or up to a month, the difficulty of swallowing keeps on increasing, then you must actually seek better advice. Go to a doctor, get investigations done, etc. Similarly, colon has different symptoms, stomach has different symptoms. Suppose you get an ulcer on your skin, and that keeps on increasing. The mole on your body starts increasing, starts itching. If there's a breast lump which doesn't disappear, if it keeps on increasing. So all these things actually will warrant investigation. Mind you, 99% of the time, still it will not be a malignancy, but do not neglect it.
Right. So, at what age do you think we should start screening ourselves for cancer? And what, doctor, are some tests that we should take to find out, if we have chances, or it is already there, and what stage it is?
Yeah. That's a very, very good question and very, very important thing, particularly for the watchers of this particular program. Cancer can occur at any age. We have seen almost newborn children, almost 6 months, getting cancer. Where you can actually see it growing. There's a swelling in the neck, stomach or swelling in the tummy, kidney or something, liver, and then it can increase. But surprisingly enough, though the pediatric tumors grow very fast, look very obnoxious, they can be treated beautifully with a potential cure. So as you go along in the adult age, along with that, we are exposed to the external kind of causative reasons of cancer. For example, the pollutants which are there in the in the atmosphere. Okay, the stress which is there in your life, and then we are voluntarily keep on smoking, drinking, and all those kind of things. Particularly if there's a lot of construction going on, it emits a gas which actually can cause a lot of fibrosis in the lung or even lung cancer. So all these things along the time, it takes time. It takes, even for a smoker to develop a lung cancer, it takes 15 to 20 years to develop a lung cancer. All right. So all the changes take place and they mature by the time you are between around say 40 years of age to 60 years of age. So that is the reason why cancers are seen mostly after the age of 40 or 50. This is the reason why we see it in the adults. In case of Western population, most of these cancers are after the age of 60. Conventionally, even in India, after the age of 60, people are not really dependent upon you so much. Psychologically, yes, but materially not so much. The children will have settled and all that. Here it occurs when you are in your late 40s or 50s, when the man is absolutely supporting the family, children are small, wife may be educated, not educated, working, not working. So the sociological impact of cancer in case of India is huge. So it is always said that the poor man always pays more for everything.
Very true.
So this is exactly what happens. We are a developing country, we get hit harder. So that is why a certain amount of knowledge of cancer is very, very important. So when do we actually start becoming aware? One is you become aware from your young age. From your school age itself, there is something called cancer. It can be cured if it is diagnosed in an early stage. You can prevent it if you take good care of it. All this knowledge should be inculcated in the children's mind right from childhood. Okay, so the fear of cancer as a disease, it comes down. It doesn't get eliminated, but definitely comes down. We normally advise the monitoring systems based on the cancer. For example, cervical cancer. Cervical cancer quite often occurs because of a virus called human papilloma virus. Okay, there are two commonest types of 16 and type 16 and type 18. Now this is communicated by sexual transmission, and women develop the cervical cancer by the time you are say 40s or something like that. So the best thing is start getting the pap smear and the HPV virus staining from the time you are 25 years till almost about 60 years. So during that reproductive age group, if you do that, that's good enough. Mammogram we normally advise after the age of first time after the age of 40, and then once in 3 years. But if you have a past history of having undergone a breast surgery, then we advise it more once in 2 years. All right. Then colon and rectal cancer, we advise stool examination, and then by the time you are 50 years of age, colonoscopy once, and then once in 10 years. If everything is all right, then once in 10 years is good enough. But do stool examination once in a year. If you find stools in the carrying blood, then further investigations are really required. Prostate, we advise after the age of 50, PSA. There's a enzyme called PSA, which is if it starts raising beyond a certain level, beyond 6, then it means that you already have a prostatic infection or prostatic cancer. Then physical examination also is done, MRIs are done, biopsies are done, etc. So all these particular malignancies, see, understand one thing. You must be having a cycle or a car or a scooter or something like that, which you take to the mechanic once in 6 months or a year. What is your most precious machine that you have? The Lord has given you a body. Okay, so at least have it checked once in a year.
Yes,
so
absolutely.
When you do that once in a year, get all these things incorporated. So that's what we say. There are high risk patients for getting lung cancer. What do you mean by high risk cancer? Those who have been exposed to pollution, like city dwellers, mine workers, chronic smokers of more than 10 cigarettes per day. So anybody who is between 50 and 80 years of age should undergo a low dose spiral CT scan. So normally executive checkups are done by X-ray chest. X-ray chest is not that sensitive an investigation. This costs only 2,500. X-ray chest costs 250 rupees. There's a barely 2,500 rupees difference. But if you incorporate that, 20% of the times lung cancer can be diagnosed in stage 1. Stage 1 has got a 95% cure rate. So the high risk patients once in a year should undergo low dose spiral CT scan of the chest. That itself is a screening. So based on that, you can actually, the family physician is the best person to decide about the screening.
Right. Doctor, you rightly said that we have been given this body, and if we really need to move ahead and move with everything working right, I think we need to take these tests. Now, another test that I've been hearing about, I've taken the test, is the hereditary cancer markers. How good are these tests? Should we all take them if there has been some? Because today in everyone's family or friend circle, there is one person who is either going through cancer or has already, undergone cancer. Some have passed away. So how good are these tests, and should we go in for them?
Yeah, there are those cancer markers where you actually test the blood. All right. So there's like CEA, which is meant actually for gastrointestinal cancers, or PSA, which is meant for prostatic cancers, and CA19-9, which is meant for pancreatic cancers. There are a group of almost about 8 of these markers, and normally, these are kind of promoted by labs also and by people also. And then, did you get that particular checkup done? So nothing wrong in getting it done, and it becomes part of your checkup once in a year. In fact, some of the hospitals, actually big hospitals, integrate that particular panel into your health checkup scheme itself. So it's a good thing if you do it. But understand one thing, these are all indirect kind of evidences. If your CA can go up marginally by even a constipation, but then it can set up a chain of fear in your mind. Oh, suddenly, do I have a malignancy? Then do a bigger scan, do me a PET CT scan and all that kind of a thing. So let the doctors interpret these things. You can get the scan, the investigation done, but let the doctors, then you don't try to do a Google Dr. Giri and all that kind of thing. Otherwise, this self-doctoring by using Google, you'll see only those things which are like very bad things only. Good things, nobody, so many people got cured, nobody's going to see. It's like having a news in a newspaper. Newspaper news is always about bad things, it's never about a good thing. So it is so that you have to be careful. So as far as these markers are concerned, yes, once in 3 years you can do them as part of your regular body checkup, but don't run after them. The doctors will advise you about it.
So you think it's better to do the spiral CT scan that you spoke about? That is better than all the other tests.
If you belong to the high risk this thing, if if you are beyond age of 50, if you are a smoker, if you live in a bigger cities, if you are exposed to pollution, for example, if you are a miner or a miner means working in a mine, really because you are from Goa, that's what I'm telling you, or exposed to that, so then you should do this particular thing. But see, please understand one thing. When I talk in terms of lung cancer, it is not only men who get affected by lung cancer. Now we find that the lung cancer incidence in women is also going up. And the reason is not very far from something. See, when you cook actually, depending upon the type of wares that you used, if it emits a lot of carbon and nitrosamines and all that, and if you don't have something which catches that smoke and throws it out, the chimney, then you are exposed to all those pollutants as badly as anybody. Number 2 is if your family member is a smoker, then you are exposed to passive smoker. If you are working in a bar as a serving person, then you are exposed, and if the bar doesn't stop people from smoking, then you are exposed to all that passive smoking. So a lady is as exposed to getting lung cancer as a man. So even these women after the age of 50 must have this kind of a checkup.
Doctor, let's take a short break. To our viewers, let's take a short break. Don't go anywhere, because doctor has a lot more to tell us. Hello everyone and welcome back to the Navin Times Talk from the Heart. We are in conversation with Dr. Raman Deshpande, oncologist, surgical oncologist, and he's been giving us a lot of tips, a lot of advice. Doctor, we have been speaking from some time about diagnosis, about tests and things like that. So now let us come, doctor, to treatment. Can you explain the treatment modalities? We all have heard about chemotherapy. We have heard about radiation. We have also heard about surgery. Now, can you take us through these processes and tell us when they are used and if there are any other new breakthroughs in technology, in science that in cancer treatment that can be used?
See, once you suspect a disease, then you go to a doctor who refers you to a specialist. What is exactly, and after that it happens. First and foremost is a tissue diagnosis, which means that if there's a lump in the breast or if there's a mass in the cheek or something like that, the doctor actually arranges for a biopsy. It could be either a needle biopsy, a punch biopsy, an endoscopic biopsy, or a CT guided throughput biopsy. So with that, actually they take a significant amount of tissue out with minimal amount of invasiveness. They don't have to really cut and open a human body anymore. This used to be the standard 30 years back, not anymore. So in one day you can actually get your diagnosis done. What do they do with the tissue? They study it under the microscope for the characters of the cells, which ultimately turns out to be abnormal as compared to the normal, and based on the abnormality, type, etc., they decide that yes, it is cancer or not. Then the next one is they also study the genetic structure of that particular thing, which is called genetic profile. Okay, so if at all there are any genetic abnormalities which they can actually exploit for treatment, that the genetic mutation marker they are called, or immune checkpoint inhibitors, which mean that can we actually use immunity as a one of the means of treatment. So this whole thing happens by the time you make a decision for treatment. Then solid tumors which are there in the body, which mean that breast cancer, colon cancer, gastric, etc., by and large, the surgery is the answer for cure of that particular tumor. The liquid tumors or the hematogenous, like the lymphoma, leukemia, etc., are not treated primarily by surgery because they are present at multiple locations in the body. You can't really cut open every place that is there, and even if you cut open, it will come back again very, very fast. So they are treated primarily by medicines, which are called as chemotherapy. Now there is a lot of misgiving about the word chemotherapy, thinking that it's very toxic, troubles you. Today we have such excellent side effect covering kind of medicine that you can by and large treat cancers, even hematogenous ones, without much of a side effect. There are certain things which you can't really prevent even today, is loss of hair, pigmentation of skin, pigmentation of the hand, the texture of the skin can change. But understand one thing, once the treatment gets over, all these things actually reverse. You go back to being normal, your hair is much better like a baby's hair, and so on and so forth. Regarding the solid tumors, what happens is we have to take the tumor out. So surgery is the answer for that. So surgery and radiation therapy are two local modalities of treatment. What do they do? Surgery removes the disease physically, radiation burns that physically at the same location, but it leaves there dead, so that the body can actually absorb that particular tumor and eliminate any evidence of the tumor by being there. Okay, so based on whichever is the ideal kind of a thing. For example, somebody has a solid tumor at the border of the tongue. So you can just do a small surgery, take it out and be done with it, quickest way of removing the tumor. But if the tumor is sitting at the base of the tongue, then the kind of surgery which is needed is quite morbid. It can be very interfering with the function of swallowing, speech, articulation, etc. So there the tumor, there you treat that particular disease with a combination of chemotherapy, which will reduce the size of the disease, and then radiation therapy. So you get the same kind of a cure, but without surgery. So all the decisions are normally made by a multidisciplinary clinic. The radiation oncologist, the surgeon, the medical oncologist, the physiotherapist, etc., all of us sit together, decide which is the best line of treatment for that particular patient, and then implement it step by step. So once all that is done, the patient is rid of the disease and he is on a path to recovery. So surgery is one, chemotherapy is giving medicines in the system intravenously or orally. Radiation therapy is the rays, external rays which are given. The latest treatment which has actually come is genetic therapy, which started in 2009, which exploits the genetic abnormalities of that particular tumor. There was a time, when a person would come in a stage 4 malignancy of lung, which means that there is a lung tumor and there is fluid inside the chest wall. That would be a stage 4. And all that we could do those days, in about 30-40 years back, was go home and get lucky. That's it. The person would live for maybe 1 to 1.5 years or 2 years at most. Today, if you find that there is a genetic mutation testing, that person can live for 10 years. You can imagine, somebody who's in the 40s or 50s and who's absolutely a backbone of his family, you're giving him not 2 years, but hopefully 10 years. You can imagine the kind of impact it can actually do. And it's just one tablet that is being done. The latest one, which is happening in the last 5 to 10 years, is the immunotherapy, which we use what we call a checkpoint inhibitor. Checkpoint inhibitors are the markers of the cells which will indicate whether they can be treated by immunotherapy. What do you mean by immunotherapy? See, chemotherapy is medicines which come from outside. They are pushed into your body through either orally or through
intravenously. Yes.
Yeah. And they will have some amount of, they will try to kill the cancer cells, but they will also have some side effects on your normal cells. And that is the toxicity. In case of immunotherapy, what you actually land up doing is you give the medicine which actually arms your own immune system. So it's like making your own police, home guards, the civil defense people so strong that they will not allow any kind of crime going on. So it's a completely different paradigm. And then that thing can continue for a long period. You can continue treating the patient for about 2 years. And by that time, your army and the police will have learned so well that they will continue doing defense altogether. You can withdraw those medicines and the person can live longer. So immunotherapy is the kind of a thing. So next one is vaccines, cancer vaccines. Now, cancer vaccines is of course this HPV vaccine, which I say. Yeah, like it will kill all those HPV viruses, so that HPV virus causing cancers, actually they will come down drastically. This has already been tried in hepatitis B vaccine, the jaundice vaccine.
Yes.
So there was a large incidence of liver cancers or bladder cancers once upon a time. In Egypt, bladder cancer used to be so common, that a surgeon who has done 6,000 removal of bladder used to be a common kind of an occurrence. Mm-hmm. Today, that whole bladder cancer is gone because of the vaccine. Today, liver cancer incidence is coming down substantially by this hepatitis vaccine. Similarly, cervical cancer can actually be almost eliminated. I would say that almost eliminated by all this particular thing. All this is rooted through your own body's immunity. The latest one is absolutely what we call as CAR T cell therapy. CAR T cell therapy, it's an easy thing to remember. You remember your car, whatever car you're using, T cell. See, fundamentally you must remember that cancer cells, which are abnormal cells, are being produced in your body all the time. It's like, people with criminal tendencies are being born in your society all the time. Why don't they become big criminals, or why don't they actually expose themselves into a series of criminals, etc.? The reason is very simple. Because your civil defenses are so strong, your police is so strong, your secret service agency is so strong, they don't allow them to reach to that particular level. So this whole immunity is mediated through an immune cell called T cell. It's called a T cell.
Right.
Multiple different type of T cells is called. So now what the whole concept is very simple. You take out the antigen of that particular cancer tumor, which means that you take a biopsy, and then you deduce that particular thing and you expose your own body's T cells, which are taken from your body by withdrawing blood, and they are exposed. So in place of having, say, 10 policemen in your area, you multiply that to 100 policemen. Obviously your crime is going to come down further.
Right.
And you take it to not 100 but 1,000 policemen. Your whole thing is like, if it works well, then the whole thing is going to be completely crime free. So your entire tumor is going to completely disappear. This concept has been tried in hematogenous malignancies like leukemias, lymphomas, etc. Proved to be very good. Resistant diseases have been completely cured, and the cure has continued for many years. Now, this whole thing is a concept and a new therapy for only last 5 years. So we don't know what is the long-term kind of a thing, but the promise is there. The inclination, it is there. So you have surgery, you have medical oncology or chemotherapy, you have radiation therapy, in which
immunotherapy.
Radiation, yeah, and then you have immunotherapy, and then now you have CAR T cell therapy. So these are the various methodologies and basket of treatment for your treatment of malignancy.
You had earlier spoken about the barriers to detecting cancer in its early stages. One of the causes is that the expenses, the financial burden that it puts, people cannot go and get themselves checked. What is a policy you think that the government should include, especially in government hospitals and clinics, where people can utilize some of these screening tests? What is that policy you think we could do?
Early diagnosis is very, very important. As I mentioned, the training for this has to start from school itself. The biggest change I would like to see in the society as a consultant in this particular line is change your mind from treatment to prevention. This is very, very important. That can cancer be prevented? To a large extent, yes. So you need to be active on social. Is the pollution. Don't allow pollution to happen. This thing. It is not possible for an individual to do it, but socially you can have pressure groups. You can have interaction with the government makes policies. You can environmental groups, etc. So that the pollution overall comes down. Okay. So that is number one. Number two is an awareness of regular health checkups, like what we mentioned, preventive checkups, etc. So if at all there is a cancer, it comes into an early stage. This thing. Then a clear mind, superstition have to be taken out. You take this jadi booty and you take that Baba's, that Tait and Ganda and all that, the amulets and all that. I wouldn't say that anybody should get into it. If you have faith, please go ahead with that, but don't neglect standard methodologies of treatment and prevention. Now, apart from this, if you want to do everything, that's good. So, prayers do help. I'll tell you one thing, prayers do help. Because, it gives you reinforcement, commitment, and certain amount of peace to follow the whole thing through and to accept whatever is going to come along with it. Okay? So, early diagnosis, what should the government do? See, the difficulty, one is accessibility, affordability. All right? So, the facility should be made available from place to place. Every 100 kilometers, we need to have a good place where actually this can be diagnosed and basic treatment at least can be done. And then referral centers can be accessed by the same person if locally it can't be treated. This is number one. Number two, affordability. This is more important. Because what happens is, okay, you will diagnose my cancer, but I cannot afford to get treated. That is of no use. It means that you have told the guy that you are going to die and I am not going to do anything for you. It will not work. So, a society which doesn't look after its own weak, infirm children and women is no society at all. Okay? So, the government actually has to look after this particular thing. There is a national cancer control program. Each state has its own program. They are actually now tying hands with all different types of methodologies of treatment, Ayush treatment, allopathy treatment, homeopathy, Ayurveda, everything they are tying up together. So that also actually is going to help. And financially, now you have the state government insurances, you have the PMJ, the Prime Minister's insurance, this thing, which actually helps bring treatment to the person's home. So now not being affordable is no excuse. So actually awareness, access and affordability at all times is the answer.
Now with AI everywhere, AI has taken, in all areas, in all arenas we find AI is very, very prominent. How has AI changed cancer, the treatment and diagnosis, and post-treatment?
See, artificial intelligence, routine intelligence multiplied by 1,000 times. Okay, machine intelligence, and machine keeps on learning exactly the same way. You learn that formula can be put into that, and then it can be done. See, when you see one chest X-ray and another chest X-ray, the abnormal chest X-ray probably has about 50 to 100 different changes as compared to a normal X-ray, which a human eye can perceive. And then within, say, maybe 3 to 5 minutes, you actually say that, all right, there is a tumor in the lung, and this is the size of the tumor, this is the location of the tumor, this is what I feel is this thing. The artificial intelligence, when you put the whole thing into a program, within a fraction of a minute, it will diagnose 200 changes. Just imagine, as of today, 200 because of the processing this thing. Over a period of time, it will actually go at maybe 500, 700, whatever it is. So, from the normal to an abnormal, it will discern the changes. It can do this for 1,000 X-rays at one time. So, you can imagine the processing itself becomes much faster, and it can actually group the things into normal and abnormal very fast. And then the humans can actually take a call on that particular thing, whether there is a treatment which is needed. This can be done in radiology, and this can be done in pathology. Again, the same, you are watching the slides itself. Secondly, the big data, which means that the data which is in thousands of characters, it can actually sit and analyze and say, okay, in North Goa, this is the type of a malignancy which is common. You have these kind of doctors there. Some of the malignancies cannot be treated by the local doctors because their specialty is different. It's getting fed all the time. So kindly send these doctors there. So now this kind of health policy decision, demographic policy decision become much easier. Forecasting becomes easier. For last 20 years, this is the incidence, this is the way it is going, this is the atmospheric changes, this is likely to be the thing. So forecasting of the health trend becomes much easier. So analysis of big data, electronic medical records, etc., all these particular things become much faster by the by the artificial intelligence. There are in Western countries, artificial intelligence has been tried. In fact, China, they say that they have put up a 10,000 bedded general hospital. We are using only artificial intelligence. You feed your symptoms, and based on whatever are the findings also, personal findings of the patient is also automatically fed, and the whole thing is automated, which means that all that you are doing is just sitting there, and your images are being transferred to the machine, and the machine is analyzing it at the same time. Once you feed your symptoms, your possible diagnosis 1, 2, 3, 4, 5 comes out, and then your treatment also will come out, and then you will get the treatment. Machines will actually keep your medicines ready, and then in 10 minutes you can go out of the hospital. All this is all artificial intelligence generated. What is the downside? The downside is sometimes ultimately artificial intelligence is, it's like what you feed, it will give up. So if you feed garbage, it will give out garbage. The Gigo principle. But of course, nobody is going to do that. So things are only going to be better. Secondly, it can actually, sometimes it's still not understood. Sometimes it can mislead. For example, the Prime Minister has actually pointed it out that artificial intelligence software which is available to you now, you say that, okay, paint a picture of a doctor writing by left hand. It's not able to do it it will again show the person in right hand, because what it does goes through the world literature. Most of the times you have doctors with right-handed writing. So the commonest one it will pick up and then it will put it. So there are mistakes it can actually do.
True.
Of course, all this will improve as you go along.
Of
but
course.
Artificial intelligence is here to stay. It is only going to make our life better. It is going to take the grunge work out from our hands, and it's going to make the efficiency of the doctors definitely.
Right. Doctor, you've been giving us so much of information, inputs, advice. What is that last piece of advice that you would like to give our viewers before we close and end our show?
For the people, I would like to say that cancer, ultimately it sounds like a cliche that cancer is curable if diagnosed early. But change the mindset, get into a preventive kind of a mode. Don't only think in terms of getting cured and all that. Secondly, have an emergency plan ready, which means that you must know which doctor you will go to, the sequence of events. In the event something like this happens in your family, then what is the next step of action? And don't be, looking at like a blind person. So where will you go? What doctors? Be a little aware of how exactly things can be treated. Lastly, understand what are the reasons for cancer. Don't be pig-headed, saying that okay, no, I will not get cancer, so I'll continue smoking or heavily drinking or anything of that sort. So incorporate preventive actions. Do exercise, maintain your weight, maintain good habits, maintain regular checkups, etc. And then that will actually, it may not make you immortal, it will make you live long and live well enough.
Right. Thank you, doctor. Thank you so much for joining us. Thank you for giving us all this advice. And to our viewers, thank you for your time, patience, and attention. Until next time, take care.